Many ergonomic experts and medical professionals believe that constant repetitive use of the hand and poor computer setup with the use of a poorly designed computer mouse are the primary causes of the carpal tunnel syndrome. Carpal tunnel syndrome is categorized as cumulative trauma disorder, Overuse syndromes, chronic upper limb pain syndrome, or repetitive motion disorders, which are all associated generally with repetitive and forceful use of the hands that damages the muscles and bones. Many believe that constant repetitive use of the hand and poor computer setup are the primary causes of the carpal tunnel syndrome. The carpal tunnel is a small canal or tunnel runs from the forearm through the wrist. Bones form three walls of the tunnel, which are bridged by strong, broad ligament. The median nerve passes through this tunnel, which actually supplies feeling to the thumb, index, and ring fingers, the 9 tendons that flex the fingers, and also provides function for the VIN muscles, which are actually the muscles at the base of the thumb. When the protective lining of the tendons within the carpal tunnel become inflamed and swell, or when the ligament that forms the roof becomes thicker and broader, leads to carpal tunnel syndrome. The result is compression on median nerve fibers due to the swollen tendons and thickened ligaments. There will be slowdown in the transmission of the nerve signals through this carpal tunnel. This ultimately results in pain, numbness, and tingling sensation in the wrist, hand, and fingers. The drastic increase in computer-related carpal tunnel syndrome injuries is due to computer mouse use is largely due to the problem that the generic computer mouse that ships with most computers does not properly fit the computer user's hand. Hence, this generic computer mouse results in excessive fatigue, pain and pressure within the carpal tunnel, and thus contributes to injuries that range from calloused hands and wrists, to carpal tunnel syndrome, and other cumulative trauma disorders. In fact, the use of a generic, poor-fitting computer mouse for a single 4-hour period caused a loss of strength in the hand and arm of up to 60% and caused the muscles being used in these repetitive operations to get overused, causing inflammation and injury. This is considered the #1 ergonomic risk factor for developing computer-related carpal tunnel syndrome. That is why finding the optimal computer mouse for carpal tunnel is so critical. Next are the primary causes of computer mouse carpal tunnel pain caused by a poorly fitted computer mouse. Shape. The shape of an ordinary or generic computer mouse that does not correctly fit the user's hand requires the user to grip and hold, which over an extended period will cause tendon and muscle fatigue in the hand, wrist, and even the elbow and arm. Overall size. The size of the computer mouse does not properly fit the size of the individual's hand. This means there is not enough support for the hand. Having optimal support and comfort is required to minimize fatigue with computer mouse operations. Individuals with smaller hands should use smaller mice. On the contrary, individuals with larger hands should use larger mice. Right and left hand compatibility. The computer mouse is not compatible with the user's dominant hand. The computer mouse should be compatible with the dominant hand of the computer user. Left-handed computer mouse users should use an ergonomic computer mouse designed for the left hand. Wrist position. An ordinary, generic horizontal computer mouse requires your forearm to twist away from its natural position. This causes more strain on your carpal tunnel, wrist tendons and ligaments. An ergonomically designed computer mouse is a must. We have researched and reviewed and now recommend these computer mouse designs as the best computer mouse designs for computer-related carpal tunnel syndrome. Here are the most highly expert recommended computer mouse designs for carpal tunnel syndrome and carpal tunnel pain, because these computer mouse designs address the primary ergonomic causes of computer mouse-related carpal tunnel syndrome pain. One of the best computer mouse for carpal tunnel designs is the Contour Prefit computer mouse. The Contour Prefit optical mouse is highly recommended by clinical and ergonomic experts as one of the best computer mouse designs for carpal tunnel syndrome due to its unique contour design and multiple sizes for the left and right hand, thus ensuring an optimal fit and significantly reducing strain and fatigue of the hand and fingers while performing computer mousing operations. To make sure you are choosing the best ergonomic computer mouse for carpal tunnel syndrome, follow these simple steps. Ensure the proper size and fit of your computer mouse. Follow the hand/computer mouse sizing chart guidelines. If you have a large hand, for optimal fitting, you must use a large-sized computer mouse. If you have a small hand, for optimal fitting you must use a small computer mouse. Contour Prefit optical mouse comes in 5 different sizes for the right-hand computer mouse, 3 different sizes for the left hand. It is the #1 recommended ergonomic computer mouse for multiple size needs. Ensure the computer mouse contour and shape should fit the user's hand. Typical shapes are the straight mouse or the kidney-shaped mouse. The contour of the mouse refers to how the mouse arches and conforms to the shape of the hand, thus providing optimal postural support. Make sure your computer mouse is compatible with your dominant handedness. If you are left-handed, you must use a left-handed computer mouse. See Contour Prefit Computer Mouse for left hand and Evoluine Vertical Mouse for left hand. Contour Prefit Mouse offers 3 sizes in the left-hand version and 5 sizes in the right-hand version. Evoluine Vertical Mouse is also highly recommended by clinical and ergonomic experts to address computer-related carpal tunnel syndrome and is also considered one of the best designs for a computer mouse for carpal tunnel syndrome because it eliminates or reduces the postural stress on the tendons and muscles due to its inherent and unique vertical or upright design. This significantly reduces stress, pressure within the carpal tunnel and overuse. The Evoluine Vertical Computer Mouse design supports your hand in a fully upright handshake position that eliminates the forearm twisting required by ordinary mice. Once you experience the superior comfort, you will never go back to ordinary mice. The Evoluine Vertical Mouse is a favorite computer mouse for carpal tunnel for these reasons. Eliminates arm twisting. The patented shape supports your hand in a fully upright handshake position that eliminates forearm twisting. Many users said the Evoluine Vertical Computer Mouse cured their wrist or arm pain. An ordinary horizontal computer mouse requires your forearm to twist away from its natural position. Reduces hand movements. The Evoluine Vertical Computer Mouse 2 and Vertical Mouse 3 does not move sideways when clicking with normal force, because the thumb naturally opposes the fingers. Pointer control is as accurate as any other good computer mouse. Easy clicking. The button force is light for easy clicking, but still firm enough to avoid accidental actuation. Optimize wrist/hand positions. Operate computer mouse in neutral joint postures. The computer mouse arch should conform to the natural arch of the hand in a neutral position. Operating posture should encourage neutral positioning of the wrist, fingers and hand. If your wrist or hand is uncomfortable in the pronated, hand-down position, the Evoluine Vertical Computer Mouse is the #1 recommended and highly rated vertical computer mouse for carpal tunnel. This unique vertical design